Hello everybody, and welcome to another episode of Physiology Made Easy with me, Dr. Amir Sandhu. Now in today's special episode I'm joined by Sioned, who has multiple sclerosis, and Sioned has kindly offered to talk about the effects of multiple sclerosis or MS on her life and how it's affected her over the last few years, and also how exercise practitioners can take into account many considerations that are important for MS patients to take part in physical activity programs. So, Sioned, thank you very much for coming in today to speak to us. It's, I think we're going to learn quite a lot of things from your insight. So before we go into the kind of in-depth parts of the interview, if you can just perhaps let the viewers know when you were diagnosed with MS, kind of how did you kind of discover the symptoms and what led to you being diagnosed?
Okay, well, I was officially diagnosed with an MRI scan going back 14 years now.
Okay.
The symptoms I had before then was for quite a few months. My left side went numb. I couldn't feel a thing, and it was really hurting me, and I was like a bit concerned because at that particular time my dad had died, so I had a massive stress in my life at that particular moment.
Yep.
And I was doing various things on the farm to get it ready for sale. So I was thinking, oh, I've done something to part of my body.
Yep.
So I was thinking maybe I've got a pulled muscle or something. So I then went into I made an appointment with a doctor. And I was referred to a specialist because all the checks that the doctor made on me at the time was fine. They couldn't find anything, so they referred me for an MRI scan.
Okay.
And within literally 6 months of going firstly to the doctor, and I lived in Shropshire at the time, to actually being diagnosed in May, so it was about 6 months period from start to finish in a way.
Yeah.
So it was quite quick in terms of diagnosis. So when they actually diagnosed me 14 years ago, they said, right, you've got MS.
Yeah.
And I didn't have a clue what MS was. One of my friends back home had heard that she had MS, but I never took any notice of what was MS.
The kind of initial information that you were given, it was obviously going to be a lot to take in, but you really didn't really know what multiple sclerosis was. Did you feel kind of shocked, confused, scared, those kind of feelings?
I was glad it wasn't. I was convinced I had a brain tumour or something that was going to make me die in the next year or something. Something ridiculous like that. Because when they said that, I was thinking, oh gosh, does that mean that I'm not being able to live? But at the time was, I was actually planning for children and that kind of thing at the time. So basically all these things went in my head, thinking, will I be able to do everything that I want to do in life?
Okay, yeah.
Because I was only in my early 30s at the time.
Right, okay.
So in terms of
your life,
age, really. It was quite a shock to have something the matter with you. Yeah. But in terms of, I've actually known for donkey's years before then that there was something, and nobody actually took notice of me.
So what's interesting for the viewers is that the point of diagnosis is just when the symptoms actually get it's that severe that you've got to go to a doctor, but the underlying changes are happening many years, perhaps decades before you get to that stage. So that's interesting.
No, that's exactly what it is.
Okay, and how did your family react to you getting the diagnosis, and how did you feel that they were supportive or understanding, or how could they kind of help you?
Well, they've known for years that I was in pain or having different symptoms over the years. Being depressed because I couldn't physically keep up with people. I was always forgetting things, and just little tiny things that actually now it wasn't just you.
Yes.
So they actually, when I was actually diagnosed, they felt quite relieved really that it wasn't in my head. Okay. It wasn't figuring my imagination that I was saying all these things. So they actually understood, and they were very supportive.
Perfect.
But at the time, it was like the time I was diagnosed was a month before I got married to my husband.
Okay.
So it was like a massive turmoil of 4 weeks before, asking him, do you really want to be with me? Being disabled and all these things. And the support I had from my husband at the time, he said, oh, don't be silly, let's get married. But it's not as simple as I'll mention later on with relationships and things like that.
Okay. So in terms of at the present moment, then, how would you describe your MS in terms of its disease course, and whether you're in a kind of active stage or you're in remission?
Yeah, well, basically, for quite a few years, I've been having relapsing remitting.
Yeah.
So I was relapsing, I was getting better, a little bit better, then I was relapsing again. And then about 3 years ago, I was relapsing on average every couple of months, and I couldn't stop them.
Okay.
So basically, it doesn't matter what medication they tried, I was always relapsing, and I was getting to be an active relapsing remitting,
okay,
which is one stage before secondary.
That's it.
Because
yeah.
I just couldn't stop the relapses.
Okay. So in terms of what medications have you taken in the past, and are you currently taking? Because I know you're taking some, you've been involved in taking some very novel treatments, haven't you?
Yes.
So tell the viewers a little bit about that.
Yeah. Well, over the years, I've tried injection type treatments, which basically tell they're quite daily. They sometimes have like once every week. Some others I've tried as every 2 weeks. I have tried a variety of. I'll name a few for you. Tecfidera is tablet form. I've tried Rebif.
Yeah.
That's injection form. And I've tried like at the beginning when I was first diagnosed, injections every day, and it was called Copaxone.
Okay.
So it wasn't actually a beta interferon Copaxone. They just thought, we'll try this and see if that'll help. So I did, and it helped for a while. But then I decided that I wanted to try for children.
Yeah.
So I came off it, and of course, for 9 months I felt amazing because the baby had the immune system that I was craving. A good immune system. Yeah. So for 9 months I was feeling really great. But then the minute my child came, I had a massive relapse, and then I had to go back straight on the medication.
Right. Okay. So, and you now have an older son, don't you?
Yes, I've got a 12-year-old son.
12-year-old son. So, how was it like then? I mean, parenthood is tough, even if you don't have MS. So, how was it like those early years? With a new baby, relapsing as well, as you said. How did you manage to get through that phase? With
a lot of mental brain power, as you say. Yes. It took a lot out of me.
Yeah.
I was relapsing, and then after about 18 months of relapsing and having to look after my son by myself because my husband had to go out to work.
Yeah.
I was living away from my family and my friends, close friends at home. It was tough.
Yeah. Okay.
So after 18 months of having a child, we decided to move back purely because I needed the help, really.
Yeah. And what about, what advice might you give to young mums who do have MS, currently, and they've got a young son? What kind of advice might you pass on based on your experience?
Always ask for help. Okay. Even though you feel like you're okay at the time, do ask for help, and do ask for breaks as well. Yeah. And rest time. Yeah. That's really important. Not to just go through all the days and I'm the mum, I have to do everything. No. Don't do it.
Because fatigue is actually a major symptom, isn't it? It almost overtakes your whole life, doesn't it?
Yes.
Do you want to tell us a little bit about fatigue and how it's impacted you? Yeah,
well, fatigue is basically, it's not tired, you can actually rectify it, but fatigue can happen from the minute you wake up in the morning. You feel like, well, I've slept a bit at night, but you still feel fatigued and feel very tired. Yeah. On some days you get a few hours in the morning which you feel great. Say that example happened to me. I was driving one day and all of a sudden it came over me like a shot, and I had to park up on the side of the road and literally close my eyes because it's so extreme situations like that. So in terms of fatigue, it does stop you doing normal things because you never know when that wall will happen.
That's right.
MS is like a battery. You have to really choose your events during the day. If you've got a very young child, like when he was a baby, you have to prioritise. Well, when he's sleeping, you have to make sure you try and rest yourself and not be a superwoman and do the washing, doing this, doing that. Always prioritise your time, because you are like a battery. Your battery will go out quicker than normal people, you know.
That's really sensible, practical advice for somebody. Okay, so that's good. And I suppose the excellent thing is that's advice that you wouldn't get in a textbook or a research paper. You know, this is, you know, from your experience living with this condition, and I think that's something that can resonate with a lot of other patients out there as well. So that's great. And I wanted to touch a little bit, I mean, you have mentioned about how it affects you psychologically. I mean, have you been through periods of, you know, I don't like to use the word depression, but because of the severity of the condition, you know, have you had anxiety, depression or stress?
Yeah, I've had years of on and off depression.
Okay.
Because, you know, the pain and the frustration of not feeling your body, you know, is a big part of MS. And yes, it does affect you, you know, mentally, definitely.
Okay.
You know, sometimes to the point that you don't want to go out to the house because you are in so much pain. And, you know, some occasions I can't walk. So in terms of when massive relapses happen and when you can't walk, you know, it mentally does drain you, and it does make you feel quite, you know, quite depressed about yourself and your you know, your life attitude, and thinking, can I do this eventually? Will this relapse finish? You know, will I get better out of this? And there's loads of things that go into your mind, and psychologically it's a big thing.
And again, practically, what kind of steps could you take to try and, I know the first step would be to get the condition under control, but what other steps could you take to get yourself into a better mental place?
Yeah, well, basically the local group that I've actually joined for quite a few years now, they have helped amazingly. The group that, you know, the chairwoman, she's a massive help. You know, if you're feeling really down, and you just pick up the phone and just tell her, you know, I'm feeling down in the dumps today. Can you just, you know, tell me I'm going to be fine, or, you know, just a little bit of reassurance. And the friends I've made through that group, that is a big key, not to be alone.
Okay, that's a good point, because I was going to ask you, how well do you feel MS patients are supported, particularly those that perhaps don't have that social structure around them? So somebody that perhaps lives on their own, is a little bit older, and you know, how do you feel they are supported? Is there a good support network?
In terms of the local group, I can 100% say yes. I'm not sure of other areas, but in terms of you know, Gwynedd and Ysmôn, I can actually say yes, there is a good you know, group of people that you can rely on. But in terms of maybe physios and, you know, professions like that, they are very rare because, well, they've got loads of patients to see, and they don't have time for everybody, do they? So you know, in terms of professions, it takes a while to actually see them. But in terms of friends and people who are going through it, they're always on hand, you know, straight away. So
I wanted to move on to physical activity and MS. We know that there's a lot of evidence showing that, you know, patients that are more physically active tend to have better prognosis of in the condition. So first I was going to ask you what your current physical activity levels are like, and what experience you've had with exercise physical activity.
Well, for quite a few years, because of my relapsing and not feeling 100%, it has actually stopped me thinking that I was actually able to do any exercise, because when you're in pain, you automatically think, you're in pain, I can't do it. So in terms of maybe what we need is a profession that actually makes us feel like, well, you can do a little bit, you know, it doesn't actually make you worse, or, you know, in terms of your physical, it's going to be good for you to increase your strength. So for years I haven't actually done anything, you know, sometimes a walk every so often, but my walking was limited. So you know, at the time I couldn't walk that far. If I had to walk, literally I was thinking I need a toilet, or, you know, need to sit down somewhere. So in terms of, you can't just go for a walk like anybody. You have to think about all these other things, issues that go around with MS. So I suppose that leads me on to my next question then, in terms of, you've got a plan for things, if you're going to do physical activity. Have you thought about, you know, kind of structured exercise programs where some other things are kind of already
laid out, so all you've got to do is turn up to a class and take part, and then you can go home.
Yeah. Well, because I forgot to mention before, in terms of my medication, I've actually trialled this Lemtrada chemotherapy in the last 2 years, which basically gets rid of all your T and B cells in your immune system.
Yeah.
Because they were attacking my body a lot. So they referred, well, this is the last option you've got to make sure you stop relapsing. And it has actually helped my relapses a lot.
Perfect, okay.
So I'm not on any medication in terms of, stopping relapses at the moment. So after that particular chemotherapy, I lost a lot of weight because medication just piles on the weight.
Yeah.
The steroids I was on, every time I relapsed, pile on more weight, and I lost a lot of weight after being off medication. So in terms of mentally thinking I'm ready to exercise, after getting rid of all the weight and things like that, you do feel a lot more positive in yourself. And then, of course, in the last few years, I've been able to walk a lot more. I've been biking, but not biking out and about.
Right. Okay,
biking in one place.
Yeah.
Because in terms of MS, yes, you may be able to get there, but the thought of coming back, you can't do it.
Yeah.
So in terms of biking, I won't go out biking by myself or anything like that, because sometimes my legs, when I do exercise, you see, my body goes into like a massive tingling effect,
right? Okay,
and numb.
Yeah.
So you can't feel your body, even though you're still actually doing some exercise.
Yeah.
You can't feel what you're doing in some parts of your body.
Okay, so that's interesting. Again, I want to follow up on that. So what other symptoms might you experience when doing exercise? I mean, are there things that somebody has to, an exercise practitioner or physiotherapist has to consider when dealing with an MS patient in their class?
Well, for example, I start on a bike. I start cycling, and then all of a sudden you start feeling the tingling in your legs quite early on literally within 5 minutes.
Okay. Yeah.
So you start getting more tingling sensations in your legs, and then your calves and the top of your legs start to hurt. Like in pain.
Yeah.
So in terms of what any kind of professional would need to know is, yes, you can still move, but you're in pain doing it.
Right. Okay. Yes.
Yes?
Yeah.
So, and maybe to the point that after you exercise, you have to sit. You make sure you don't move from your exercise bike for a few minutes to get your circulation going, or your the tingling sensations loosen a little bit to get better, and then you move from whatever your exercise you're doing
to the next. Okay. And you mentioned earlier on about MS hugs, and I know that can be something that kind of almost manifests when you're exercising. Have you had that happen to yourself as well?
Well, I've had quite a few MS hugs over the years, and it is a very, very painful situation. It's like having cling film around your chest, to the point that you can't breathe. Like a massive stones on top of you, and you're just like out of breath. So in terms of exercise, when you've got an MS hug, I'm thinking, who does that? Fantastic. I couldn't do it if I was in that particular situation with that relapse. So it depends on the kind of relapses you have in terms of what exercise, if any, you can do.
Right. Okay.
In terms of that, the MS hug, I couldn't do any kind of exercise.
What kind of other programming? So I'm thinking more about as a person who has MS, you go into an exercise class that's being run by an NHS physiotherapist or even a private rehabilitation clinic. What would you want those practitioners to consider in relation to MS? How should they deal with an MS patient?
Well, they need to encourage them to do it first.
Okay. Yeah.
The first step of crossing that of I'm going to do it and go to the actual class is a big thing for MS patients, because a lot of us have got rid of our confidence because of our bodies that can't do anything at stage, in terms of relapses and things. So in terms of I think to build up confidence is a big issue, and once you've done that, then once you've actually gone into the class, and start telling them, well, I've got relapsing, my leg hurts today.
Yeah.
Well, they may actually not do as much with you on your leg. Maybe they'll concentrate on your arms. But in terms of my arms, sometimes they're so heavy that I can't actually lift any, and my arms never mind anything else.
Yeah.
So, you know, it really depends on your situation on that day, because every day is different.
Even things like timing of the exercise class, you know, so I'm thinking about fatigue, for example, and having sessions at specific times of the day. What could you tell the viewers about that?
Yeah, well, you know, like for myself, I can only talk about how my body reacts to things.
Yeah.
I would actually prefer to do exercise in the morning, because that's my best time of the day.
Yeah.
Because by the mid-afternoon time, I just get so fatigued, I just want to have a rest.
Right.
So in terms of somebody telling you, right, we'll do an exercise class, but it's going to be 2:30 in the afternoon.
Yeah.
Well, nobody would turn up.
Right. Okay. Yeah, because they're all
you know,
tired.
So tired and lack of motivation. But in terms of some other people, they take all morning to get up from bed. They are so tired and fatigued in the morning that it takes them until 11 o'clock in the morning to even contemplate thinking of going out of the bed.
Right. Okay.
Because they've had a really poor sleep.
Yeah.
You know, it really depends on your day, because you know, as I'm saying, every day's different, and your body reacts differently every day.
How do you think you know, the current awareness of MS actually is?
We need to do a lot more.
Okay.
You know, NHS, professions, anybody. There's a whole lot of information to do with cancer, and you know, which is understandable. But in terms of neurological diseases, I think we need to get it out there that, you know, we are there.
Yes.
You know, and people do need to realise that it's a hidden disease. You know, you can't physically see my pain, can you?
No,
for example, today you can't see me tingling and you know, in pain. So in terms of MS and neurological in general, I think you need to advertise it a lot more and make people aware, really.
So kind of like health promotion and getting some of the key facts about the condition out into the public domain.
Yes.
So that people, and I'm thinking the general population, practitioners, husbands, wives of you know, individuals that suffer from MS, children as well, so that they have access to that information and know what their loved one might actually be going through. Okay, so some really interesting information. And given the current situation that we're going through at the moment with COVID-19, how have you felt that COVID-19, or you know, specific things like the lockdown, affected your MS? Because I know that, you know, there's going to be individual needs for certain groups. So how was that situation like for yourself?
Yeah, it's been difficult because I've been shielding. So in terms of having a letter in March saying, well, you know, from the doorstep, basically, you can't go out. And then all of a sudden you're thinking, oh gosh, how I'm going to deal with it, and how I'm mentally going to deal with it, really. So for that 3 months, it was tough. It was tough, and luckily the local group chairperson, she set up a WhatsApp group, and there's quite a lot of us on that group, and we contact every day, see how everybody is, and we do a Zoom meeting every week to chat to everybody. And I think without that group, I think been very, very depressed.
And the local. That's brilliant. Well, Siona, it's been an absolute pleasure to hear your experiences of dealing with MS over such a long period of time. I certainly wish you the very best for the future, and I would like to thank you for the great information that you've given today. Well, I've certainly learned a lot, and I know that the viewers at home have also learned and will also be learning a lot as well. So that's all we've got time for today, and I hope that you've found the information valuable. Join me again very soon on a new video. I'll see you soon.